Okay, so a couple weeks ago when we got together, we just sort of absent-mindedly threw up a post, ask us your questions, and we got
Like
130
Yeah,
something.
It's a lot of responses.
And then we freaked out and we were like, we can't answer anything. We have to go. So here we are. Let's answer a couple and then we'll get through the list eventually. But all right, we got a bunch of people wanting to understand about whether they should get a flu shot. We had people asking about Babesia and all the co-infections and alternative protocols to antibiotics, certain herbal protocols like Booner, Cowden. I did Dr. Zhang. People do different things.
Right.
Okay.
So let's just start with the flu shots. So, you know, this is a terrible flu season, as it's all over the news, everybody knows. And anything that we can do to reduce your chance of getting the flu is probably going to be an okay thing. The problem is the flu shots kind of stink. I mean, everybody knows 100%. They're never as effective as kind of they claim, unfortunately.
And did you read that study that said that people that are inoculated with the flu shots shed 6 times as much viral?
No, I didn't see that one, but it's supposed to be 32% for the most common strain and 10% for the less common strains this year. So that's pretty poor efficacy. And
did you get a flu shot?
I did. So having said that, I mean, I had the flu really, really bad 1 year in residency, and I could not believe how sick I was. I was sick for literally 3 weeks. I mean, it was a 3-week flu. It was awful. And I just said never again, and I kept taking the flu shot. And since then, I've gotten the flu a bunch of times, even with the shot. So I know it's not very effective.
Elderberry.
I know. No. So one thing that we're big fans of is elderberry syrup. So the original brand for that is Sambucol, Sambuchol. And that's been shown in randomized controlled trials to work and reduce the duration of flu symptoms by 4 days. And Tamiflu only reduces like 1 to 2 days.
1 to 2. And it's, what do you know? Pharmaceutical versus not pharmaceutical.
Right.
The non-pharmaceutical works better.
And it tastes great. It tastes like jam. I've been taking it twice a day. We went on a cruise 3 weeks ago with my family, and it was like a floating petri dish, and everybody was sick.
Disgusto.
And we didn't get sick, you know, at all. And we're all on the elderberry. And now the price of it is skyrocketed. It was 12 bottles a bottle, be $12 per bottle before. Now it's like $30 a bottle.
How did you learn about elderberry?
Oh yeah, I don't know.
Just wondering. Now I've been taking it.
Dana turned me on to elderberry. It was a good find, and it's definitely. And then I looked into it. I read the studies, and it's very legitimate. So
I always send you data. I don't just willy-nilly recommend.
Legitimate.
Yeah, some of my recommendations are legit. Yeah. No, but I've been taking it prophylactically this entire flu season. I don't even want to give myself a jinx, but that's all I'm going to say. I've been taking it every day, and I buy it at CVS or.
And you do not get the flu shot, right?
I don't.
Right, and it's not on my recommendation that you don't get the flu shot. That's your personal decision. When people ask me about Lyme, can it exacerbate Lyme symptoms? All these vaccines can. You know, I've seen some kind of horror show responses to vaccines in patients before they were diagnosed with Lyme. I, thank goodness, have not seen any horror show responses to people once they've started treatment for Lyme. So I do think these weird immunologic after effects are really from an untreated situation largely. I'm not saying it can't happen. You know, people are already treated. So that's why I've been, you know, cautiously kind of pro-flu vaccine this whole time. But I tell people, look, it's possible that it can stir the pot, and it's just, like I said, it's just not a great vaccine.
Do you remember I came to see you once, and like 3 hours later I had a raging flu?
I know, yes. Yes.
I think
awful.
You were so not happy because we were supposed to go on vacation.
I was so not happy.
You didn't get it.
No, I didn't get the flu, but you know, I wash my hands 20 times a day also.
Well, you do that anyway. It's like your thing.
No, that's my thing. So,
that's like your whole deal.
Yeah. So, but it keeps me from getting the flu.
No, and you shouldn't touch your face. I mean, that's one thing I strive. Like, I don't go to a restaurant and touch a menu, and then I'm conscious of that.
Especially your eyes, your mouth, your nose.
Yeah, it's gross. Okay, so Babesia. There's so much confusion about whether Babesia is chronic, whether it's the big one. We get lots of letters and comments about people feeling like they have chronic Babesia, and that's why they're not getting better. What do you think?
I mean, this is it's so troubling for a lot of people. One of these major, Lyme researchers, I saw him at a conference recently, and he's like, I don't understand why everyone is, talking so much about chronic babesiosis. I'm looking, I don't see the literature. He's like, I was like, because there isn't really that much.
Yeah, I haven't seen
there's
it either.
some, case reports of folks having failed, like azithromycin, and metron for babesiosis. It's not like it doesn't happen, and we can show evidence of persistence of babesia sometimes after treatment, but it does not seem to be the big thing. There's certainly very much less published, almost nothing really,
Well, I think
compared to what's for Lyme and Bartonella.
Okay, so I wonder if part of the problem or part of the confusion is because there's overlap with Bartonella and people don't realize.
There's
you can get these chronic
so
sweats.
much overlap with Bartonella. Bartonella can cause recurrent fevers and sweats and weight loss and anemia, splenomegaly, which is a large spleen, lymph nodes. Bartonella can look identical to Babesia. So I think that's what the main confusion
But the
stems
treatments
from.
are different, right?
Yes and no. Not necessarily. I mean, these are big guns, and so we don't know what the best treatment is for Bartonella. In the test tube, drugs like Zithromax work real well, and then in the body, they kind of work less well. But I found that even if you use things like a tetracycline class with Zithromax repeatedly, you can get people to the other side of Bartonella frequently. But in terms of what works and what doesn't work for Bartonella, there's some research going on at Hopkins now, at Johns Hopkins, to look at what works against persistent forms of Bartonella. And a lot of people have a favorite. Some people think that rifampin is the best drug, in combination with atetracycline or sometimes
I never
with
took
Biaxin.
rifampin, by the way, and I got better. I just want to say that because I got a call actually from somebody last night asking me if I took rifampin, and you offered it to me.
Yeah.
And I refused it.
And some people think that Bactrim is the best treatment, and some people think that quinolones like Cipro and Levaquin are the best treatment. And there was,
There's risks to all of those.
It's true. So in studies, those drugs do come out higher than the other antibiotics for Bartonella. Bartonella is an intrinsically antibiotic-resistant bacteria, and there's really only one class that's truly bactericidal, and that's the aminoglycosides, and they're kind of scary toxic. And they don't get inside cells, which Bartonella does, and they don't cross the brain, which Bartonella can do. And so there are just inherently difficult aspects to thinking that an aminoglycoside is going to cure Bartonella in the body. It can really, really help, but it can really, really hurt and cause permanent deafness and permanent balance problems. So in the drugs like rifampin and Bactrim and quinolones, they have sets of potential side effects that other antibiotics don't have. So they are, I think, a bit more dangerous, but I have used them in patients. But I've gone back and forth with this issue so many times.
Can we talk about artemisinin? Because that helped me so much with Bartonella.
Yeah, so artemisinin is also an anti-malarial. That's how it's claimed to fame. It was converted into a very closely related chemical and made into a drug called Coartem, which I don't use because I'm scared of it, because that class of animal,
thing?
Yeah, the non-primate, animal models will show that it paralyzes the animals.
Yeah.
It's kind of scary. But artemisinin doesn't seem to be as dangerous as that, and that's the herbal version.
Horrendous neuropsychosis, though, by the way.
Yeah.
I mean, like, severe. But would you say that the artemisinin, so Artemisia that's the one that won the Nobel Prize, right?
Well, they won the Nobel Prize for converting Artemisia into the dihydroartemisinin derivatives, which are what's used and what's prescribed.
Okay, that's like the WHO choice for malaria.
Yeah, I mean, it's the most rapidly acting antimalarial on the planet. And when it works, so when it first came out, we were seeing people get benefit from it. I was frankly shocked that it worked for Lyme, because I thought its mechanism of action, its mechanism of action is it causes a oxidative radical in conjunction with iron, like free iron. And Babesia and malaria require iron. Bartonella, Brucella require iron. Lyme doesn't.
Huh.
So I didn't think that it would work for Lyme, and then Johns Hopkins showed that it worked for Lyme. I was surprised. So I was restricting it to patients who had Bartonella when I first started looking at it. And I have a whole safety protocol for artemisinin, because again, even though it's herbal, it's not without risks. So there are some herbs that are super safe and some that aren't. I mean,
Well, the question is, have you had? Obviously, I talked about getting a lot better on artemisinin, but have you had a lot of patients that have had good benefit on?
Yes, yeah, definitely. I've had patients who nothing else has worked where artemisinin has worked. And I've seen the same with all of these treatments, whether it's tetracycline or these other herbals like oil of oregano.
Okay, so what about other herbal protocols along with antibiotics?
I think that people have a generally good response to the Cowden and Buter protocols.
Okay, great.
They tend to be somewhat complex sometimes,
Mm-hmm.
but I don't think that the answer just lies in antibiotics. The big problem I have is when people they limit themselves.
Mm-hmm.
It's like, I'm just going to take herbs. I'm not even considering antibiotics because of being scared of antibiotics, or I'm just going to take antibiotics because I don't believe in herbs because I'm not a holistic person.
Right.
I mean,
Well, medicine
So-
is herbs. I mean, allopathic medicine, a lot of it is derived from herbs, from nature.
Yeah, definitely. So I do think that we should avail ourselves of everything that's out there that can get you better, and you can go down kind of the herbal path if you want to choose to do that, solely. But if it's not working, I've had patients come in to see me on like 5 years of herbs, and they're horribly ill, and they don't want to touch antibiotics. I'm like, what are you doing?
Yeah,
I mean, it's your personal choice, but it's not a choice I would make.
No, no way.
If it's not working, if it's working, fine. If it works, great. That's more power.
Do you meet a lot of patients who just did herbs and got better? I mean, do you meet people along the way? Obviously, they're not going to end up in your office
Not
asking.
that. No.
I mean, I've never met anybody personally
Not
that has
that-
just done herbs with a bad case of Lyme and gotten.
Well, also we
where
should
they
talk
wanted to
about
go.
that there's a spontaneous remission rate with Lyme anyway, without treating. A lot of people will get over these illnesses. Like animals, a lot of times they'll wax and wane with their illness too. So, I mean, there are patients in whom some herbs have been amazing, but it's an individual response thing going on.
Okay, great.
Okay,
Thank you.
Thanks.